Recording.
All right, hello from the biocontainment unit. Today we are going to be doing a training video on both donning and doffing for our expectations of PPE for particularly our COVID airborne plus contact precautions. Dr. Logan Weygandt here is our attending from the ED, and he is going to be the role model and physical model today. So what we're going to be utilizing today is our N95 plus face shield, which would be the same kind of requirements if you had your PAPR hood and your PAPR. Just for training purposes is what we're using. And we're also going to be using our pink reusable gown, which the Ford Motor Company was so kind in donating from airbag material. So expect hotness, literally. All right, Logan, so first things first, before you do anything or you ever question hand hygiene. All right, and again, our COVID is airborne plus contact, which means to us double gloves. It means our protective gown, our N95 plus face shield. So Logan's putting on his fit tested, which is important. Fit tested
this year.
Yes, this year, and he has not had an influx or decrease in weight of 50 plus or minus, so it is appropriate, plus face shield. Thank you, sir. So we have N95, face shield. We're going to put on our first set of gloves. Beautiful. Sorry, they're wet. Fantastic. And we're going to put on the lovely gown. You may find several different types downstairs with the hands here. You can see you might have a, I guess this is ropey kind of material. You may have one that actually has a thumb fitting, or you may have one that had a thumb cut into it. And you can see here also there is to be an X every time that they're cleaned and recycled, and then once you get to the end, they're supposed to be tossed. So, allegedly. And we have a snap at the top, a Velcro snap at the top, and then you also have a tie. And with the Velcro, just as a kind of thought, you have to get out of it, so at some point, as you can see, Logan kind of put it here just in the beginning, touches to touches, because you're going to have to pop this, self-pop this. So if you seal it really tightly, sometimes it can be a challenge. Yeah, and as you can see, these finger loops, they can also be a challenge. And we do a small tie here in the front so that you can also see where you are to untie it. You may also hear about yellow gowns, which are our disposable gowns, and they're utilized in our critical care situation. Previously, you would tie them in the back, and they would be pop the front and then pop the back and roll them up. Here you have to actually untie these. So if you do have the yellow gowns on, it's the same procedure with doffing. We'll discuss this later. But Logan is suited up, he's got a second pair of gloves on, he's done his appropriate hand hygiene, and he is now eligible and appropriate to enter the room safely.